Bill Gates has said he intends to donate the vast majority of his fortune, all $114 billion of it, over the next 20 years. It's one of the largest sums of money any one person has ever amassed, so how does he intend on spending it? Well, for one thing, this week Gates announced a $2.5 billion investment into women's health causes around the world. And he sat down with Stat, twice in fact, to discuss what kind of initiatives this money will be used for, why he chose to focus on women's health, his role amid major cuts to US global health funding, and more. On Monday morning, my Stat colleague Matt Herper and I met with Gates in Boston. Matt interviewed Gates, and for my part, well, I didn't forget to take the lens cap off.
So big news today. $2.5 billion over 5 years for women's health and principally R&D. Why? Why is this where this money should go at this time?
Well, the foundation, starts by looking at challenges in health, particularly in lower-income countries. And pregnancy is stunningly understudied. The vaginal microbiomes, for the primary funder in that area, just like we were a decade ago in the, gut microbiomes. So we build on the research that gets done for rich world medicine, but whenever there's some gap, like in non-hormonal contraceptive or vaginal microbiome, then we do whatever research is needed. And so things like the ultrasound is a tool to look during pregnancy. That starts by gathering a massive amount of data, both rich world and developing world pregnancies, and looking at the ultrasound data and seeing what the outcomes are and seeing what the patterns are there. But giving birth is still a very risky time, particularly in low-income countries. Even conditions like preeclampsia and gestational diabetes aren't as well understood for the rich world as they should be.
The Trump administration has made enormous cuts to global health programs. USAID, for example, which is an agency founded by JFK in 1961 and was a major funder of global health programs, was essentially dissolved. This has led some observers to wonder if the Gates Foundation might pick up some of the slack in the absence of U.S. funding. But here's what Gates had to say.
One thing we make very clear is we're not able to replace what the U.S. government has canceled. It's just not our role to say, okay, the U.S. government wants to save money, and so we'll help them do that. That's not our role. Of the diseases we work on, HIV, we're the second biggest spender, but the U.S. government, at least in the past, has been the biggest spender. But everything else, malaria, TB, non-hormonal contraception, vaginal microbiome, everything but HIV, we're the biggest R&D spender. But we go everywhere to find philanthropist government to help fund that. Some of those things we can literally fund ourselves, and if we have to, we will.
Stat hosted an evening event with Gates at the Broad Institute in Cambridge, Mass. He brought some medical devices his foundation helped supply and did a little show and tell for the audience.
Do you want to explain for the audience what this is?
Yeah, so the incredible insight, that's a drape that when a woman's delivering, you put it underneath and you'd let this part, kind of sit at the end of the table there so that whatever blood is being lost accumulates in the cuff here. And so what
there are markings here.
So you get a sense of, okay, how much bleeding is going on. When we looked and said, okay, why were women dying? You'd ask the clinicians and they'd say, hey, I didn't think, there was that much bleeding. It's very hard to just gauge looking, and people systematically tend to underestimate it. Also, what came out during our trial work was that the threshold had been set too high. We had part of the study group which used a lower threshold. I think it was 500 mils was the low threshold, and the WHO standard had been a fair bit above that. But we saw the death reduction was a lot better. And because the drugs you're intervening with when you see that level of bleeding are very inexpensive and essentially no side effect, the downside of treating additional people is extremely small, and you're literally going to be saving lives.
The drape is an inexpensive and decidedly low-tech device. But Gates also showed off a device they're rolling out that uses AI to analyze ultrasounds. Well, maybe it won't be called an ultrasound. You know what? I'm going to let Bill Gates explain it.
So this is an ultrasound, and of course, ultrasound technology is basically a chip-level technology. And so over time, we think the ultrasound will be present in primary healthcare and be used for a huge number of things, in the lung, breast cancer. But the one that was super important for the areas we work in was to understand pregnancy risk. If you're in a rural area and you're not near enough to a site that could give you a C-section, say you have obstruction or problems with the cord or whatever, or preeclampsia, and you decide, wow, we need to do a C-section, this risk rating that the ultrasound scan, combined with massive amounts of data we gathered about abnormal and normal pregnancies, you can do this risk rating and say, okay, this 10% of pregnancies looks like it has enough risk that the family should make the investment to make sure the woman is near to a health facility that can do the C-section. And so this is just in the process of being rolled out now, but we already see that more indications will come in, and eventually, could take 5 to 10 years, this will be a tool that's present everywhere in primary health care. There's things to be careful of. So like, we don't actually probably won't call it an ultrasound in some places because we don't show an image. So the fear that ultrasound at times was used for sex selection, we get around that because it's a blind scan, and just the software is making this risk assessment. So that's pretty exciting.
And this wasn't the first time Stat has sat down with Bill Gates. Back in 2018, 2 years before COVID hit, Gates talked with Stat about his fears of a global pandemic.
Of all the things that are out there, what could cause an excess in a single year of 10 million deaths? Now, clearly a big war could, and a pandemic, natural or created by bioterror. The natural pandemic, the last gigantic one, was 100 years ago. We are healthier today, but the speed of travel, and therefore the speed of global spread, that works against us.
The numbers are all over the place depending on where you look, but COVID caused the deaths of somewhere in the neighborhood of 10 million people. And now there's a record-breaking measles outbreak in the US. And all the while, vaccine skepticism is seemingly at an all-time high. Here's what Gates had to say about that.
Kids in the US, if you get measles, maybe 4 per 1,000 will die. And that's terrible, and vaccine skepticism and lack of coverage has and will create more deaths. In the countries we work in, it's more like 200 per 1,000 because of lack of medical care, nutrition. And so vaccine skepticism in the US kills more children outside the US because it transfers that skepticism than it does inside the United States.
I just want to give a big shout out to the Stat events team. I'm lucky to work closely with them on all our event coverage, and I gotta say they truly are the best in the biz. This event with Bill Gates had to come together pretty quickly, and as usual, it was a smashing success. And in just a couple short months, the Stat Summit, our flagship event, is happening in Boston. It's 2 days of expert panels, Stat's trademark journalism, and networking events. I call it Statapalooza. It's always a good time, so check out the link in the description for more info. And if you enjoyed this video, please like and subscribe. It's a little click, but it's a big deal for us. We'll be back next week. Same stat time, same stat channel.